With opioid overdose deaths still at near record levels, tens of millions of dollars in opioid settlement funds are going to cities and towns here in Massachusetts.
The money is supposed to help ease the devastating crisis, but 5 investigators revealed earlier this year that most of the funds remain unspent. Our Mike Beaudet is looking for solutions in Fund One town, strategizing to get money out into the community quickly, Mike.
That's right, Maria. The opioid settlement funds are coming from drug manufacturers, distributors, and retailers. Cities and towns have already received $41 million, but they've only spent a small fraction of the money. We found a possible model for action and results in America's hometown.
Now quiet breath.
This is Yoga for Kids, organized by To the Moon and Back, a Plymouth nonprofit dedicated to the littlest victims of the opioid epidemic.
This is a challenge. Can you sway in the wind?
They're helping families with children born with in utero substance exposure.
They were very tiny. They wouldn't eat. They were up all night. They would cry a lot.
Anna Shagnon adopted siblings.
There was a lot of care, a lot of nurturing at first, a lot of scary moments. We had nurses from the moment they walked in the house to help us through it because we had been through it.
To the Moon and Back offered the support Shagnon desperately needed.
You get sent a little bit of information from DCF, a little bit from the doctors, and then you're on your own. And that can be very challenging and very scary.
They tested him at birth and he was born with it in his system.
Amy Labby's son was 2 years old when he moved in with her family. To the Moon and Back has helped her navigate the challenges.
He was nonverbal, he had difficulty hearing, he had dental issues. So he had a lot of complex needs that regular everyday doctors were kind of brushing off as toddler boy. Until we found this group.
Ladies and gentlemen, the true stars and heroes of the Plymouth Arise community. Grantees stand, please.
To the Moon and Back is one of 5 organizations receiving $50,000 grants from the town of Plymouth. The money is part of the opioid settlement funds that started flowing into cities and towns in Massachusetts in 2022. But most of the money remains unspent. This is personal for you.
Yep, it is. I had adopted my oldest at 10 days old, and he was born dependent.
Teresa Harmon is founder and executive director of To the Moon and Back. The grant will help the group hire its first paid employee. What is this grant going to allow you to do?
This will allow us to help even more families. We're going to provide kind of ongoing case management specifically to any child here in Plymouth under the age of 18 and be able to kind of follow them and, look at their testing and help them develop a plan of action.
Michelle Brady is Plymouth's Commissioner of Health and Human Services. Plymouth is projected to get between $3 and $4 million in opioid settlement funds over 15 years. What's your advice to other communities that aren't moving as quickly as Plymouth?
Take the leap of faith. The state will support you, other towns will support you. Just do it.
So I think Plymouth has done a fantastic job.
Julia Newhall is with the state's Department of Public Health, which is offering guidance for communities on the opioid settlement funds. How would you assess where we stand right now in Massachusetts in terms of cities and towns spending this money and spending it effectively?
When I assess it against other states, we're in a really good position, right? I would say in the Commonwealth as a whole, we're getting there.
Newhall says that communities across the state are much further along than they were a year ago. Most are still in the planning process where they're figuring out how to spend the money, but she says about a quarter of them have actually started using the funds. Mike Beaudet, 5 Investigates.